what is obesity? Obesity can be defined in various long words, or we can also take how the WHO or the World Health Organization defines it, but in easy terms, it's excess of deposition of body fat on a body. Right? Now, when excess of body fat gets deposited, the patient or the person becomes obese. How do we actually quantify it? To quantify it, again, we can have n number of parameters, but the easiest one, or taken acceptable worldwide, is the BMI, also called the body mass index. Now, BMI is a formula wherein we take your weight in kilograms and your height in meters square. So, weight in kilograms divided by height in meters square will give you a BMI. BMI can actually be, it's actually different for the Westerners or the Western population, and it's also different for the Asians. For Asians, anything between 18.5 to about 22.5 is taken as normal BMI. Anything more than that is taken as overweight. And once you cross a BMI of 27.5, yes, 27.5, it's taken as obesity, which is also classified as a disease today. So more than 27.5 is taken as class 1 obese, more than 32.5 a class 2, and more than 37.5 is taken as class 3 obese. Whereas in a Westerner, more than 30, 35 and 40 is classified as class 1, class 2 and class 3. So now that we've defined obesity, we should also see who are the people who would actually undergo a medical or a surgical treatment for obesity. So patients who are obese or overweight till let's say about 27.5 are the patients who should be very careful about their diet, their dietary modifications, their lifestyle modification, and so forth. A few of the drugs which are also available after consulting with your endocrinologist or your physician or even your surgeon for that matter can be taken for weight loss, and this should be in addition to your good healthy lifestyle. So if you think that you could probably take some drugs and lose those 4-5 kgs or lose that flap, that's absolutely a wrong way of doing it. Patients who go beyond 27.5 BMI, it becomes increasingly difficult for you to lose weight with exercise, with dieting and drugs. So for patients who are obese with associated comorbidities like diabetes, hypertension, dyslipidemia, metabolic syndrome, these are the patients when surgical options would be a good option to be considered earlier in your lifestyle, earlier in your lifetime, rather than waiting for obesity and your related comorbid to set in and cause organ damage and then opting for bariatric surgery. So, summarizing, BMI is a good tool. More than 27.5, you need to be getting some sort of medical help. If associated with comorbidities, you need some surgical help. And in the following lectures, I would also, or in the following interaction, I would also talk about what are the surgical options available for you. Thank you.